Okay, this video is from Dr. Mcdougall, the doctor who fought for you, by me, Pete Rogers. We're talking about cancers, like cancer part number 5 or so. There's something very interesting here. Dr. Mcdougall's got another big statement here. He says that he read a paper by a guy named Alan Cunningham in 1977. It was a great paper, and the gist of it was that Cunningham pointed out that he thought the concept of overnutrition with protein might be a factor in the pathogenesis of lymphoma. So what is he basically saying? He was saying that eating animal foods causes a lot of inflammation and it makes the immune system hyperactive, and it seems like the immune system sometimes has difficulty turning off from that. So animal food is going to be associated with more inflammation in general. Saturated fat's going to cause this is not Mcdougall, this is me now talking, is going to cause the neutrophils to release myeloperoxidase, MPO, and that's going to collapse the glycocalyx, expose the adhesive molecules like VCAM, vascular cell adhesion molecule. The white blood cells are going to bind to the arterial lining. So you're stirring up inflammation in that sense. And you've got kind of a complex thing here. You get other things like xenocylitis, the abnormal sialic acids on the glycoproteins with animal foods like, dairy, beef, etc. But what's interesting is he says the immune system sometimes becomes hyperactivated and then it can't shut off and you get lymphomas. Lymphomas are you get big lymph nodes. It's a type of cancer. If you want to talk about cancer, there's like 4 main types of cancer. There's carcinomas of epithelial tissue, the lining cells of different organ systems. That's the most common group of cancers. Then there's sarcoma of connective tissues, okay, like deep tissues, muscle tissues, bone tumors, things like that. Then there's lymphomas of the lymph node glands, so to speak. And I'll kind of throw in the rest of your leukemias and all that with that. And then the fourth thing is there's melanomas, which are almost like a cancer, unique to itself. Those are the 4 big categories of cancer. Okay, so this was a big statement, though, saying that animal foods hyperactivate the immune system and it can't turn off and you end up with lymphomas. Big statement. So he's saying that's why they're more common in upper socioeconomic groups because they eat more animal foods which are more expensive in the past. He says they're higher in bovine proteins, in like milk proteins and dairy proteins. And that's interesting too because of course that ties us in with the work of T. Colin Campbell in his great book, The China Studies. And T. Colin Campbell said the most powerful carcinogen is dairy proteins like casein. And then why would that be the case? Because he says the dairy proteins are designed to make a baby calf, grow super fast, like let's say grows 600 pounds in 1 year. So they really accelerate growth. And you don't want a growth accelerator, let's say around a cancer cell to potentially make it grow more rapidly. Here he says, secondarily, dietary protein augmentation in rats increases the number of lymphomas which develop. Burkitt's lymphoma appeared to be due to a chronic stimulation by malaria. That's what he said. I'm not sure about that, but that's what was said. Cow's milk causes lymph node enlargement. Lymphomas are more common in celiac disease. Animal foods are a common source of cancer viruses. Okay. Diffuse large B-cell lymphoma accounts for 35% of non-Hodgkin's lymphomas. Okay. Another thing that's not often talked about is if you look at glyphosate, that has been associated with increased risk of lymphoma. And that's actually an important association. We're not going to get into that right now. Stephanie Seneff wrote a lot about that in her book, Toxic Legacy. Okay, Dr. Mcdougall's continuing. There was a patient with follicular lymphoma stage 3A who underwent a 21-day water fast only at the True North Health Clinic, and it seemed to really help. At 9-month follow-up, her lymph nodes were non-palpable and she remained asymptomatic. Yeah, I had read about that. That's very interesting stuff. High-fat diets, such as occurs from most animal foods, they can suppress the immune system. So you got a weird thing going on here. You have a suppression of the immune system, which can weaken its ability to remove a cancer, simultaneously associated with increased inflammation from animal foods that can hyperactivate the immune system. So there's a little bit of a schizophrenic thing going on here. Animal foods are acidic. They lack dietary fiber, so you can get leaky gut. That can cause inflammation. They lack antioxidants, so you have less ability to deal with oxidative stress. In this meta-analysis, there was a strong evidence that indicated that consumption of red meat and processed meat is a risk factor for progression of NHL, non-Hodgkin's lymphoma. And you also got to remember, too, like I said, that glyphosate is associated with increased risk of lymphoma. Well, you'll take these feedlot cattle and you feed them the GMO sprayed corn, for example, or GMO soy, and that's sprayed with the glyphosate. The GMO corn especially sprayed with atrazine, but you've got these cattle being fed stuff that contains atrazine, that contains glyphosate, so it can bioaccumulate in these cattle, and then people eat that cattle. There was a strong statistical association between red meat intake and the risk of lymphoma. Now, here's something else interesting too. There's been some viewers that have been asking me repeatedly to, look into the causation on multiple myeloma, and I've sort of been too busy to do it. But here it is, right here in this work from Dr. Mcdougall. Foods of animal origin are likely to play a role in increasing the risk of non-Hodgkin's lymphoma and of multiple myeloma. And the reference is right here from the Asian Pacific Journal Cancer Previews 2014 with the numbers right here. Okay. Current treatment of lymphoma often involves chemotherapy, like with this R-CHOP method. He talks about 40 to 50% will relapse and redevelop cancer. Mcdougall says the Mcdougall diet should be part of cancer treatment. I would agree with that. You got a low-fat diet there. Going to be low in inflammation. It's going to help the immune system function better to hopefully control the cancer. Then he also said the more dairy a person consumes, the higher their risk of NHL, non-Hodgkin's lymphoma. Eating vegetables reduces the risk of getting lymphoma. Okay, he continues, Dr. Mcdougall. And by the way, you want to check out all these things, you go to Dr. Mcdougall Health Center, go to his YouTube channel. You can watch videos about these things. You can read the newsletters that he's written about these. That was from the video, Dr. Mcdougall's Expert Guide to Beating Prostate Cancer and Surprising Facts About Estrogen Diets and Cancer. Dr. Mcdougall continues. This is from his video about the sugar-feed cancer, and he says, eating sugar does not increase cancer. That's an important statement. Eating sugar does not increase cancer, but eating fat does. Fat will cause insulin resistance. Elevated insulin is associated with an increase in insulin-like growth factor, and those are thought to increase the risk of cancer cells replicating. Dr. Mcdougall continues, the more carbohydrate a population eats, the less cancer they have. If a cancer patient improves their diet, they are likely to live longer. Okay, what does he recommend for cancer patients? This is from his newsletter, February 2015. He says, losing weight is helpful. Obesity increases the risk of getting cancer, and obese people die sooner from their cancers. He says, cut out the meat. This removes substances known to cause cancer progression. Stop drinking cow's milk or any dairy foods. This removes substances known to cause cancer progression. They're both going to increase insulin-like growth factor, which is associated with cancer progression. Okay. He says, reduce intake of growth stimulants, including animal foods of all kinds. They all increase growth factors like insulin-like growth factor. Give up vegetable oils. Vegetable oils, including safflower oil, corn oil, olive oil, they encourage tumors to grow faster, more so even than do animal fats. Okay, he says, avoid cancer-promoting chemicals, including environmental carcinogens and persistent organic pollutants. Increase immune system enhancing plant components, phytonutrients, so to speak. Yeah, low-fat plants, immune system works better, okay? High-fat meals, immune system is suppressed. There's been a lot of people talk about it. Lydia Lynch gives a lecture on that at Global Immunotalks, really good, where she talks about how high-fat diets just suppress the immune system. Okay, omega-3s also suppress the immune system. There's a lot of people trying to say omega-3s are so wonderful. Yeah, right, they're so wonderful. They suppress the immune system, okay? They increase the risk of prostate cancer. They increase the risk of atrial fibrillation. They increase the risk of insulin resistance, of obesity, of atrial fibrillation. It's like, how is that going to make you healthy, increasing the risk of all that stuff? I doubt it. Okay, what else does he say? Try to have healthy intestinal bacteria. Well, you get that from eating dietary fiber, from eating plant foods, okay? Increase the intake of cancer plant sterols. I'm not sure what I'm going to eat to do that, but you get the good amount of fat packaged in the optimal way when you eat low-fat plant foods. Raise the consumption of cancer-fighting folates. Folate implies from plants. That's from newsletter 2006, December. Raw food vegetarian diet helps protect us from cancer. Oh, that's a big statement. Raw food vegetarian diet helps us. I know that Ruth Heidrich said she preferred eating a raw food diet. I've heard other people say that they felt the raw food diet was helpful. I would think it's helpful if you keep it low in fat, but if you're talking about a raw food diet, a lot of times you're talking about fruits. Fruits tend to be low in protein, and perhaps the low protein is helpful. You're also going to get a lot of antioxidants, a lot of vitamin C. Dr. Mcdougall newsletter, December 2012, on the annual physical exam. He says, avoid annual physical exams. I would agree with you. The more stuff they poke and prod, the more money they get paid. It's a higher level of E&M codes, evaluation and management codes. But the more they poke and prod, the more they're going to find a false positive. You're going to get stuck getting it worked up. He said physical exams are orchestrated to make healthy people become diagnosed as sick. You walk into the doctor's office as Georgia Francine, and you walk out as a patient with a disease. The main reason detecting disease early does not help reduce death or suffering or disability is that the treatments, pills and surgery, usually are ineffective and dangerous. That's an important point too. If the treatment stinks, you don't want to be diagnosed because then you get a treatment that stinks. And there's a lot of things where that is the case. Okay, that was Dr. Mcdougall newsletter, February 2015. Will a healthy diet stop or slow most cancers? And that's it for the chapter on cancer. I hope that was helpful.